Sale at Hamilton Place.
Ah, it's my way, and it's on sale.
Channel 3 School Patrol with David Carroll. Coverage you can count on.
February, as you know, is Heart Month, a time to focus on your heart health, but very often that conversation can take place once a heart concern has arisen. So it's a good time for us to check in with Matt Thomas. He is with the Cardiopulmonary Rehabilitation Program at CHI Memorial, where every day they are seeing patients who've undergone a heart attack or a heart surgery, looking to find their strength back. Good morning to you, Matt.
Good morning. Thanks for having me.
You take on a very critical role because obviously the key idea here is to prevent needing your services to begin with. But if you find yourself with a heart diagnosis, getting the right exercise program is key.
Yeah, absolutely. And for that reason, we really promote our programs as a secondary prevention program. So, once people have already had a main event, the big question is, what can I do next to prevent that from happening again? And that's where we step in to help them really make sure that they take on the lifestyle changes. And we do that through both exercise and education that they need to make so that they don't have to go through this process again.
Well, obviously, in all forms of exercise, you kind of want some expert eyes on you to make sure you're not doing the wrong thing. But I would think if you've had a heart scare, you are really afraid of stepping up and getting going again. I would think fear is a big obstacle to overcome.
Yeah, and you're absolutely right. I think a real big part where we step in, what we help people do is see what they are capable of and do it in an environment where they're monitored. So all of our folks are on telemetry. We're watching their heart rates and rhythms, their blood pressures, and we really give them that confidence to get back and do those things that they not only want to do every day, but maybe that they have to do every day, focusing on occupational tasks. Maybe it's getting out doing things with the kids and grandkids and really helping them achieve those goals. And like you said, really bringing that anxiety down of what might happen next following that heart event.
So does it go through phases? Let's say it's something, let's say you've had bypass surgery and somebody finds themselves in your care. Do you do like incremental phases to get them back up to full speed?
Yeah, actually, we have a 3-phase approach. So phase 1, we come right in after the procedure and we start walking right there on the floor. So getting up and out of bed can really have a big impact on how well people recover. So in that phase, we're really working on getting folks home, getting them settled, making sure that they don't have any risks of a readmission. The phase 2 is kind of our traditional cardiac rehab program, and that's when we're doing all the monitoring, setting it up an exercise prescription, and really focusing on education that is individualized to the patient. And then phase 3, we have a lot of folks that really continue to stay with us through what we call phase 3 or our maintenance program. And on that tone, we have people that have been with us 20, 25 years just because they like to have the surety of kind of that medical fitness approach and know that someone's here looking out for them.
So I don't know how much you deal with the insurance side of things more than just the physical side of things, but is this something that insurance will typically cover?
Yes, it is. And in fact, this is insurance really have been big advocates for these programs because the outcomes are so much better for the patients that participate. We do all of that insurance groundwork for our patients so that they can focus on healing, but these are reimbursed programs up through our phase 1 and phase 2 program. Phase 3 is not reimbursed by most insurances, but it is something that we work on a very minimal cost to make sure that our patients can continue to participate throughout the lifespan.
So when your patients are in there and you're doing the rehab with them, I'm assuming they're having to wear masks, or if they're a little bit sensitive because of breathing concerns, is there some give and take there?
Yeah, so we actually are very fortunate. We operate in a 22,000 square foot facility. So we've socially distanced all of our equipment, brought our class sizes down just a bit to make sure that we can space people out for that exact reason. After you've had a heart procedure, it can already be a little difficult to breathe. You probably find yourself in a position where you haven't been as active or exercising quite as much as you want. So we distance, and while our participants are on the machines, we allow them to bring the mask off if necessary. But still on that front, we're very, very working very hard on our COVID protocols, cleaning, right, etc.
And if you are someone who's experienced a heart scare, I guess you have to be extra careful because you really are in that most vulnerable category, right?
Yeah, there can be some immunosuppression following a procedure. You know, we really have to focus on making sure, and even in normal conditions, that we're minimizing the risk of infection. So we really do pay good attention to that. But the cardiovascular service line here has been great from start to finish to make sure that we're keeping our patients protected throughout the continuum.
Okay, in terms of getting into your care, is this something where your cardiologist also needs to practice at Memorial, or do you work across hospital lines?
Yeah, we're outpatient services, so we work for any referring physician. That can be from primary care to cardiovascular services.
All right, Matt, thank you so much for your time this morning. You can get in touch with the Cardiopulmonary Rehabilitation Program at CHI Memorial. They're right there on Citico Avenue. Their phone number 495-7764. Always you can learn more by going to memorial.org. We're back after this.
Weather changes all the time, and so does technology.